The Take Action Against Diabetes Distress TAD program. This is a program that involves non-pharmacology interventions and care coordination to reduce the stress in the diabetic population. The TAD program is meant to educate and support patients, improve emotional well-being and psychosocial functioning, reduce diabetes-related health risks such as cardiovascular complications and mortality, and optimize self-management and health behaviors. This program is meant to accomplish the standard diabetes teaching and support the home care team offers. Evidence supports the use of specific psychosocial support and self-care education to manage diabetes distress and reduce suffering in this population. This program consists of 6 phases. The first one is assessment. During this phase, the nursing staff will recognize and understand the patient's needs. And this includes listening, being present, and creating a caring relationship with the patient. The diabetes distress screening scale will be utilized to evaluate the level of distress. The patient's ability to manage distress, self-management, and their coping skills will be addressed using the coping self-efficacy scale. Consults for additional support will be ordered if needed. The next phase is the action plan. During this phase, the nurse will assist the patient in creating a personalized action plan with measurable goals and strategies. In addition, the patient will be provided with diabetes education script and the Care of Diabetes Index and how to manage diabetes distress. And these are tools that will assist the patient in meeting their goals. The next phase is coping and distressing. In this phase, the patient will be provided with supportive interventions and tips for coping with diabetes distress, utilizing 10 tips for coping and diabetes distress, and they'll be also provided with YouTube and iPad links for meditation, mindfulness, and relaxation activities. The action plan will be reviewed with the patient. The coping self-efficacy scale will reassess um, and measure the patient's self-management confidence and their confidence with communicating with the healthcare provider. The nurse and patient will practice a meditation activity before the end of the visit. The next phase is review, reinforce, and empower. This phase is about evaluating the effectiveness of the education and support interventions. The patient's diabetes distress level is reassessed using the PAGE scale. The action plan will be reviewed with the patient to reevaluate goals and strategies. The coping self-efficacy scale will also assess the patient's ability to manage distress, self-management, and coping skills. And if the patient needs additional support to manage their distress, the primary care provider will be notified for a consult at that time. The next phase is committing to goals. During this phase, barriers that may have affected the patient's ability to follow the action plan or reach their goals will be addressed. The nurse will support the patient as needed. The patient will be provided with a copy of locally available resources to help them with diabetes distress if needed. The last phase is the celebrating success and planning for the future. During this phase, the overall effectiveness of the education and support interventions will be evaluated, including hospital and emergency room visits that may have occurred during the program period. The nurse will assist in contacting locally available resources if needed, and the patient will have the opportunity to express feedback regarding the teaching plan provided by the nurse and the success of the interventions for the patient. They will also have the chance to say whether they felt supported and if the program met their needs. The patient would be discharged if all their goals was met and presented with a congratulatory card.